Thanks for joining us today. My name's Corinne. I'm one of the organizers as part of Climate Year. I also work in the College of Engineering in the Sustainable Water Resource Engineering Lab. But I'm here today representing the Climate and Sustainability Working Group that have been putting on Climate Year. This is a year for Drexel and the Academy of Natural Sciences to celebrate and accelerate climate work happening across Drexel University. As part of Climate Year, we've been doing a lot of tracking and benchmarking to better understand operationally as a university where we are and where we need to go. We're also seeking opportunities for faculty and students to tackle climate change topics in their courses and in their research ventures. And we're promoting interdisciplinary dialogue to bring our many pieces of the university together to collectively address the climate crisis. And one of the ways that we're doing that is through this Climate Year speaker series. Today is the first one of this speaker series. I'm very excited to launch this today. Each month, we're bringing together scholars from different schools and departments to talk about climate change and the different ways that they're working on it. So today we have the topic of infrastructure and health, particularly related to transportation, which our speakers will talk about today. Next month, in coordination with the Academy of Natural Sciences exhibit on Drowning World, we'll be talking about water and coastal resiliency. And then in July, we'll be talking about technology, society, and politics. We do have a draft list for what's going to be happening to the rest of the year. So we hope to keep these up monthly, and maybe even after Climate Year, we hope to continue them quarterly. If you want to stay in the loop about these different events, you can email sustainability@drexel.edu. We've been pushing these out through a listserv that we maintain. Or you can also visit the sustainability website. There is a calendar on that website where we're keeping up we're posting all of these events. And just a quick note that we are recording today's session, and we're going to archive this in our future sessions on a Climate Year speaker series page that will be launching after this session. So you'll be able to watch any of the ones in case you missed them. We'll have all of those on our sustainability website. There's also other Climate Year events that are coming up next week. There's a lot of events going on right now. On Monday next week, there's a virtual climate change panel, a panel discussing the Biden administration's climate and energy plan. That's happening on Monday at 3 p.m. There's a Zoom meeting ID. I'll also put the Zoom link in the chat. There's not a registration page. It's just, you can just go right to the Zoom link at 3 o'clock on Monday. And then on Tuesday, students from Fossil Free Drexel are hosting a seminar on engaging students in climate action to discuss the divestment movement, opportunities for activism in Philly, and solutions for climate justice. That's at 5:30 on Tuesday. Again, that's just a Zoom link that you can go to at 5:30 on Tuesday, and I will put that in the chat when I'm done speaking. And before we get started today, I just wanted to make a quick acknowledgement that the land that most of us, I think, are on, depending on where you're joining us from, but probably most of us right now are on stolen land from the Lenni Lenape tribe. And as we discuss the many different solutions to the human-caused disaster of climate change, I often find myself reflecting on indigenous approaches to living in harmony with nature. And I hope that in these crazy busy times that we can all just kind of take a collective breath and look at what nature is providing for us all the time. And maybe we can start to bring nature-based solutions to the forefront of the solutions, the many of solutions that are in our toolkit. I always want to kind of keep looking back to what nature is providing us and trying to bring those back to the forefront. And it's the very, very least that we could do to honor the people whose land that we have stolen. So I'm going to stop sharing my screen and introduce our moderator for today. Akilah Chatman is our moderator. They are a junior in the Department of Biodiversity, Earth, and Environmental Sciences, majoring in applied environmental science and minoring in climate change, which is a new minor at Drexel. Passionate about the intersection of social justice and environmental science, they are leading research on science communication and urban ecology in the Ward Lab, as well as participating in a local program through the Pennsylvania Department of Environmental Protection to develop a greenhouse gas inventory and write a climate action plan for Abington Township in Montgomery County. Currently on co-op, Akilah is working in the watershed lab of the Patrick Center for the Academy of Natural Sciences, doing research on how sea level rise is affecting saltwater marshes and coastal forests. Akilah, I turn it off to you.
Hi, everyone. First, I want to apologize beforehand if my parrot decides to make too much noise while I am talking, but I'm happy to be here. First, I would love to introduce Dr. Diez Roux. She is the Dean and Distinguished University Professor in Epidemiology at the Dorn's Life School of Public Health and the Director of the Drexel Urban Health Collaborative. Originally trained as a pediatrician in her native Buenos Aires, she completed public health training at the Johns Hopkins University School of Hygiene and Public Health. Dr. Diez Roux is internationally known for her research on the social determinants of population health and the study of how neighborhoods, particularly urban neighborhoods, affect health. Thank you so much for being here with us today.
Thank you, Akilah, and thank you, Corin and the organizers for setting up this series, which I think is so timely and so important. So I'm delighted to be joining you today. So I'm going to share my screen. Can you see it? Yes?
Yes.
Okay, let me put in, okay. So I'm going to talk about, our theme for today are the connections between transportation, climate, health, and maybe COVID too. So I'm going to start out by giving a few general comments on the links between transportation, environment, and health. And so the title of my brief presentation is Transportation Policy as Public Health and Environmental Policy. So before talking about how transportation connects to health, I want to share a few facts about population health to sort of frame the way we might think about how policies affect health. The first is to acknowledge that when people think about the drivers of ill health, they think about individual level factors most of the time. I mean, this is the most common thing that we see in the newspaper, or even when you talk to people in general, and highlighting the importance of biomedical risk factors like diabetes, hypertension, obesity, so-called lifestyles, the behaviors that people choose to take on, their genes or their access to treatment and diagnosis and screening. And all these things are important, but they don't really explain the variations that we see in health across populations, the big variations that we see in health across populations or even over time. They don't fully explain that. And so what we actually see when we look at the data is that we can think of health and disease as the pattern response of social groups to their environment. And the environment is, as you will see, can be defined quite broadly. And the corollary of this is that because health is so influenced in so many ways by environmental factors broadly defined, in order to understand the drivers of population health and act on population health to make people healthier or to reduce inequities in health, we have to act at multiple levels and act through multiple sectors and act through policies that go beyond healthcare and beyond health education, beyond convincing or teaching people that they need to make, quote, the right choice, because many times the choices that people make or the behaviors that people engage in are very much conditioned by the circumstances under which they live and the environments in which they live, and their history as well. So when we think about more broadly the drivers of health, thinking, expanding beyond healthcare and the traditional biomedical risk factors, we realize that when we're looking at health, we need to think about global trends, as shown in this slide. We also need to think about particularly health in cities. We need to look at urban policies and interventions. We need to look at local and individual determinants. And we really need to think about health and environmental sustainability as interlinked and mutually reinforcing. And I'll come back to that in a few minutes. But what I want to highlight in this slide is that when we think about the policies or interventions that affect health, in this case, this example is about urban health because that's a big part of our focus today, but it applies to health anywhere really. We need to think about actions that, as I said before, are within the health sector and within public health systems, but also outside of the health sector. And this is where the connection to public transport and to so many of the other things that we do as a society comes in. So what do I mean by this, this connection between health and environmental sustainability? If you think about the consequences of having, say, compact, dense, and transit-oriented cities, i.e. cities that are not automobile-centered, but that are public transit and walking and cycling centered, some of the consequences of having cities that are like this include that they have smaller urban footprints, that they have less car use, that they have more walking. Smaller urban footprints are related to less energy use, less impacts on biomass and agricultural lands. That has consequences for greenhouse gas emissions and for access to fruits and vegetables, for example. Less car use is related to less air pollution, to shorter commutes. More walking is related, shorter commutes is related to more free time and lower consumption of processed foods. And there's evidence for all of these links in the literature. Less car use is also related to more physical activity. More walking is related to more physical activity as well and increased social interactions and safety. And several of these things, including shorter commutes and increased social interactions and safety, are related to better mental health. And access to fruits and vegetables, air pollution, physical activity, and consumption of processed foods are all related to chronic diseases. So you see how this is really a system that, less car use is related to lower traffic-related injuries. So this is really a system where we see outcomes that, in blue here, that are environmental, so compact, dense, transit-oriented cities have beneficial environmental outcomes, and they also have in red beneficial health outcomes. So this is why we talk about cities, urban areas as presenting great opportunities to simultaneously promote health and environmental sustainability. These two things are linked and reinforcing. And this is what people refer to as the health and environmental co-benefits of urban policies. And public transportation in general plays a big role in affecting health and environmental sustainability. So as key, transportation is key to both urban health and environmental sustainability. So speaking a little bit more specifically about transportation, as you can see in this figure, transportation is a significant component of greenhouse gas emissions, about 30%. And it's also, there are many studies linking different types of transportation to health. And in particular, walkable, bikeable, transit-oriented communities generally have a number of beneficial health outcomes, including more physical activity, lower body weight, lower rates of traffic injuries, less air pollution, improved mobility for non-drivers. Public transit is linked to physical activity as well because public transit users tend to walk more, for example, and other mechanisms that support public transit like bike and ride programs also have many of these beneficial health outcomes. And in fact, this is from a very nice review a few years ago in the Annual Review of Public Health. Many of the main causes of death, as shown in this figure, can be linked to transport in one way or another. Of course, there are many other factors that affect these diseases, but cancer, cardiovascular disease, through their link to physical activity and BMI are related to transport. Respiratory diseases for sure, because of their links to air pollution, motor vehicle crashes, of course, diabetes as well. Even, suicide through some of the mental health consequences of mobility in cities, could have some indirect links to transport. So many health implications of transport. Of course, it's important to recognize that there is a cycle, and many of these adverse health consequences of automobile dependency in cities, because that's the real driver, generate, there's a vicious cycle that is illustrated in this figure, by which dependence on automobile, it sort of reinforces and creates this sort of feedback loop that has a number of other adverse consequences for health. So the question is, how can we intervene through policy to break this cycle? And we can, because planning decisions affect land use patterns, affect travel behavior, and travel behavior has a number of impacts. So this is not something that is out of our control, natural. It is something that we have created as a society. And so I think the big question now, and in particular, as we come out of the pandemic, is there a way to create living environments that promote health and environmental sustainability? And transport, particularly in urban areas, transport is a big part of the answer to those problems. So there are a number of health promoting transportation policies that have been specifically studied, including traffic calming and speed control. No surprise here that that's related to health through a reduction of injuries and mortality. Promotion of active transport, as I said, cycling lanes, walkability through its physical activity and other benefits. Public transit service improvements related to frequency and quality. Transport pricing reforms, a number of options here, road and parking pricing, higher fuel prices, distance-based vehicle insurance and registration fees, so people pay for how much they use their car, and also public transport pricing, free public transportation, subsidized or even free public transportation. Mobility management marketing, which is a bit of a jargony name for a number of programs and information resources that encourage people to switch from the car to other modes. So instead of giving free parking, give an incentive for people to give up their free parking at work and instead take public transport or walk or cycle. Complete streets is another example, which is a sort of a planning approach that has as a principle the idea that roads should be habitats for all users, not just cars, but also pedestrians, cyclists, and automobiles. It's quite interesting to see with the pandemic how our streets have changed. They've been taken over. Places that were reserved for cars, where you had multiple cars parking, are now taken up by tables. So what's going to happen when we go back to normal? Are we going to have cars back in those spaces or not? I also want to emphasize another point, which is that transportation policy, not only is it important to health and the environment, but it's also important to equity. And why? Well, because of the health and non-health benefits of transportation policy, which often some of the health consequences of the systems that we have in place are not even, practically all of the health consequences are not equitably distributed. And so some of those benefits are going to accrue to groups that are disadvantaged or structurally at a disadvantage. Transportation has many environmental and access implications. And also, there is an inequitable distribution of the costs and benefits of transportation. There's a vicious cycle by which car use subsidized for the rich generate pollution that is mostly experienced by the poor. And so, I think that's another element that we really have to think about. Many aspects of the automobile dependent system that we have accrue benefits to the rich, but accrue environmental hazards and health consequences for poor or minoritized populations. And this is just on the right. There's just an example of a project that we did several years ago now. We're now actually doing a similar project in another city, but evaluating the impact of a new public transportation system, a cable car in Medellin, Colombia, city in Colombia. We compared, this cable car was connecting poor neighborhoods outside the city to the downtown area of the city. And so using a sort of natural experiment approach, we evaluated the impact of this new public transportation system on a number of health-related outcomes, including violence and safety. And we found that not only did this public transportation system reduce commute times, increase access to job and educational opportunities, but it also reduced levels of violence and homicide in these communities. So many potential health equity benefits of, not just health equity, equity in general, benefits of transportation. And so to finish up, I think now, and perhaps we'll have some discussion on this in the panel, as I'm sure you've seen in the press, there's quite a bit of discussion about, what's going to happen to our cities, what's going to happen to our transportation systems now after COVID, what opportunities has COVID created? On the top left there's a commentary. This is from the World Resources Institute, which is an institute that does a lot of work on sort of environmental sustainability, safer, more sustainable transport in a post-COVID world. And on the bottom right is an article from the Washington Post just a couple of days ago. After showing its worth during the pandemic, momentum builds for free or reduced fare transit. And I think I'll stop there, and I look forward to your questions and discussion with the other presenters. I pasted also in here a link to a blog that I wrote, I guess a month ago about this topic as well, in case you're interested. Thank you very much.
Thank you so much for that. That was really wonderful. Next, I would like to introduce Dr. Mimi Scheller, who is a professor of sociology and the head of the Sociology Department, as well as the founding director of the Center for Mobilities Research and Policy at Drexel University. Her list of public works is extensive, including 12 books, 7 of which she is the sole author. As founding co-editor of multiple journals, including Mobilities, and authors of several highly cited articles, she helped establish the new interdisciplinary field of mobilities research. Thank you for being here, Dr. Mimi Scheller. We're excited to hear from you.
Thank you, Akilah. Thanks so much. And thanks to Corinne and the whole Climate Year team for inviting me. And thank you, Dr. Diez Roux, for your presentation, which I think is a really nice dovetail with what I'm going to present. And I'm going to share my screen. And I'm going to be focusing especially on this question of post-COVID, the health disparities we've seen during the pandemic, and also what the sort of future portends for both transportation and what I'm going to call mobility justice. So the pandemic brought us a huge mobility disruption. It was both a demobilization of many people's lives and ways of moving, but also it remobilized a lot of things in new ways. It especially drastically affected public transportation, driving down ridership by 90% in many cities and threatening the financial viability of our public transit systems. At the same time, the inequitable transport infrastructure and the legacies and continuance of racism in the United States have driven these racially uneven exposures to the coronavirus, as well as sparking the Black Lives Matter protest movements over the way in which Black, Latinx, and Indigenous people's mobility is often stopped and arrested and involves policing. So these unequal mobility regimes, as we refer to them in the kind of field of mobilities research, are the basis of racial and class-based inequities, health disparities, and forms of segregation over many decades that have kind of shaped our urban fabric and where people live and what exposures they have. Some, however, also see the post-pandemic recovery as this great opportunity, as a chance to promote low carbon transportation, especially, for example, bike lanes or what are called open streets to be used by pedestrians and bikes. Here in Philadelphia, we see a lot of debate over the MLK Drive along the Schuylkill River and whether it will be kept as it has been since the pandemic started without any cars using it, or whether it will be reopened in August for car traffic. So the question I want to ask is, how can we recover from the pandemic mobility disruption in a more equitable way that does not simply entrench these health disparities more deeply? And as you'll see, this is also connected to questions around climate change. Because what we see in data that's been collected by Michael Sivak, who has been working on this data collection for many years, is that the population adjusted changes from January 2021 as compared to January 2019, what you see is all the graphs that are going up, that are rising up, those are, the blue line is sales of cars and light trucks. The green line is road vehicle miles. So we see a brief disruption at the start of the pandemic in March and April 20, and then we see them rising, and in fact, surpassing levels of 2019. On the other hand, the huge drop down, the yellow line is air passenger miles, domestic. The green line is purple line is rail passenger miles, and the black line is public transit, what are called unlinked trips, so single trips. So we see that those fell 80, 90%, and then they've come back a little bit after, April, May, June, July of 2020, and then they've just stayed flat, okay? So we have rail passenger miles are still down 73%, and unlinked trips on public transit are still down 62%. And at the same time, vehicle sales are rising, as is the price of gasoline. So what that says in terms of climate issues is that we're seeing the most favorable forms of active transport and low carbon transit are in free fall kind of and are stalled. And then the most greenhouse gas intensive forms of transport, driving cars, are rising. So this doesn't bode very well. Another set of statistics that I want to line up alongside that is the fact that we know that Native Hawaiians, Pacific Islanders were most likely to have contracted COVID-19 as of this is from February 2021, and Black African American people were most likely to have died. And we see also fairly high levels for Hispanic, Latinx people on those graphs, and then lower numbers for white and Asian populations nationwide. This data comes from the COVID tracking project at Boston University. And if we just focus in here on the number of Black people nationwide who have died from COVID, it's at a rate of 1.4 times the rate of white people. We've lost at least 73,462 Black lives to COVID-19 to date. And Black people account for 15% of COVID deaths where race is known. So what's the link between these different figures? And I want to look here at, this is from the Philadelphia Transit Plan that came out last year. It's the city's guide for improving public transit. And one of the reasons for improving public transit, it says here, is because it connects residents to opportunity, it supports our economy, and is critical to fighting climate change. But in many ways, it's designed for inequity. In Philadelphia, recent travel surveys show that residents of color face commutes that are on average 12 minutes longer than white residents, adding up to 50 lost hours over the course of a year for someone who works 5 days per week. And this is because of housing, disparities and segregation. Low-income riders also have paid more for their commutes because of transfer fees and connectivity challenges in neighborhoods outside of the city's downtown core. And these transit disparities can be traced in large part to a bus network created in the early part of the 20th century to reflect a city that had not yet experienced suburban flight and the loss of industry, as well as then the more recent development trends, including West Philadelphia's ongoing boom and the growth of commuting patterns that don't involve center city. So what we see is the way our transit system is designed is leaving inequitable situations that relate both to the kinds of exposures that Dr. Diez Roux was talking about, and as well as questions to do with how people of color are more exposed to health harms. So this slide is about structural racism as elemental exposures. That is, vehicles that produce what are called PM 2.5 pollution, right? And a nationwide cross-sectional study showed that these exposures are much greater for Black and Latinx communities who have historically faced disproportionate levels to air pollutants like PM 2.5, yet are least responsible for the emission of such pollutants, and they are linked with an 8% increase in the COVID-19 death rate. So one of the ways of explaining that death rate are that groups who are most exposed, their lungs, to breathing vehicle emissions are disproportionately vulnerable to COVID-19 because of these historical and ongoing exposures. So how can we kind of fix some of these disparities? And the pandemic recovery has been thought of as possibly leading to a sustainability transition as we promote walking and biking and kind of recover transit, or on a more negative kind of trajectory, is it the triumphant return of the automobile? So for some policymakers, the dramatic emptying of city streets prefigures a world in which we've reduced the dominant system of automobiles and fossil fuel dependence. And I talk about that at automobility as a system, which involves vehicles and streets and pipelines and oil drilling and the entire structure of that assemblage across our world. And during the pandemic, as cities have implemented open street space for walking, biking, and in some cases rapid transit, people suddenly saw this like new way of being in their city, this great possibility that was opened up. But that has also been controversial in some cities where these things like the streeteries, those restaurants out on parking spots or on sidewalks, as well as bike lanes, are perceived as serving elites. In many cases, they are blocking access for people with disabilities and making it difficult to navigate. And then, as we saw, for people who have those longer commutes and who, because of racial disparities in housing, cannot get to the walkable and bikeable areas, they still need to access the city. So there's a lot of dispute about why that should be our number one sort of policy response here. So will the mobility disruption of the pandemic offer the opportunity to launch new kinds of urban infrastructure? Or will the dominant system of automobility prevail as people take, especially to their car coons, as we sometimes call them, this kind of protected shell that people feel safer in their cars? And what are the implications then for reducing greenhouse gas emissions? So here are some images of the kind of open streets that we saw, or what were called corona pistes in Europe, and the kinds of people taking to cycling, especially in New York City. There was a heavy kind of mediatization covering this transition. And there was a lot of hopefulness that this would sort of stick and that this will give us a chance to improve our bike infrastructure. Large-scale studies of percentage change in cycling levels in 2020 during the pandemic compared to 2019 show quite a lot of variability. And this graph starts with Canada at the top, and then various regions of the US, and then a number of European countries. And the dark black lines are cycling during the full week, and then it's broken down into weekends in gray versus weekdays. And so what we see is in some places, cycling increased a lot, and it especially increased on the weekends. In other words, more like leisure cycling. And in other places, we actually see declines in weekday cycling. So for example, East Canada, you can think of, that's probably Vancouver there. They actually saw big declines in cycling. And in Ireland, big declines in cycling. So very uneven impacts, which might help us think through in more detail what might happen going forward. These are some of the European kind of bike lanes that sprung up during the pandemic. And then also we saw large bike lane expansions in Latin American cities as well during the pandemic. So the question I want to get to comes out of the work of the field of mobility studies and questions around mobility justice. That is, who represents cycling cultures and for whom? And when we try to make low carbon transitions, when we try to promote active transport, we need to think about who is represented, who defines the space, who makes the policy decisions, who designs the infrastructure, what languages and imagery are brought to the table, and who is left out. And I draw on ideas that come from this like growing body of literature and community organizations and movements around bicycling justice, bicycling and race. And this is happening across the country. There's the book by an important thinker, Adonia Lugo, on bicycle race. And also she helped co-edit Bicycle Justice and Urban Transformation, Biking for All. And what we see here is like this kind of contestation over who the streets are for, who has access to safe transportation and to health and to low carbon transportation. And in terms of climate change, what does that mean? And I draw also on my own work on mobility justice, the politics of movement in an age of extremes, where I think about the ways in which uneven mobilities are constitutive of politics and power. Mobility justice is an overarching concept to think about how power and inequality inform the governance and control of all forms of movement. So equitable mobility transitions must overcome the existing system of inequities through promoting not just transit access, but broader forms of mobility justice. And I'm just going to really quickly try to just talk briefly through some of the movements for mobility justice. A group called the Untokening and People for Mobility Justice describe it as an umbrella term to address how street safety goes beyond car-based violence. That is, it's not just about Vision Zero, but about things like gender-based harassment and violence on the street, the fear that immigrants may feel existing on the street, economic insecurity and nuanced lived experience of marginalized groups, and the movement against the criminalization of Black and Brown people, or what Charles T. Brown, an urban planner, calls arrested mobility. And all of this, when we think about climate change policies and how transportation policies come into play, we need to think about this. Historical disenfranchisement, disinvestment, and disproportionate exposure to pollution and repressive policing in communities of color continue to negatively impact our collective health, wealth, mobility, and security, according to this group, the Untokening and People for Mobility Justice. So we need to recognize and reconcile those historical and current injustices experienced by communities of Black, Indigenous, Latinx, people of color, as we plan for climate change. Identity influences vulnerability. So people live at the intersection of multiple vectors of oppression, and unfettered access to mobility in public space are not guaranteed. So just because we have bike lanes and just because we have low carbon transportation doesn't mean that everybody can access it and gain the benefits from it, especially when it's linked to gentrification. And that's a huge issue here in Philadelphia, where environmental racism and disinvestment have disconnected many urban communities from green spaces and disproportionately created toxic environments. As the Untokening argues, infrastructure improvements like bike lanes and green space often result in an environmental gentrification as long-time and lower income residents are displaced by more affluent populations. So our climate change policies really need to address environmental racism without green gentrification. And just to lead to some conclusions and questions, in the aftermath of this pandemic and its massive mobility disruption, I would argue that we must not return to business as usual. We're not going to go back to normal, or we shouldn't go back to normal. How can we overcome the chronic disinvestment in communities of color, dismantle the race, class, gender, and other barriers to mobility, and repair the devastating impact of past highway building, segregation, and transit inequity? Now, some of the new infrastructure bills include some possible ways of doing that, and it's a big question of what we invest in and how that gets decided. And to do that, we have to ask, how can we include more people in transport planning, protect the right to freedom of movement, but also the right to remain in place, the right to breathe clean air? Pandemic recovery will definitely benefit from greater mobility justice. And I'll just end here with some of the further reading for anyone who's interested in this topic. And I'm happy to share this with people after the event. So thank you.
Thank you so much for sharing all of that with Dr. Scheller. We really enjoyed your presentation. Our last speaker for today is Dr. Shannon Capps, who is an assistant professor of civil, architectural, and environmental engineering. Dr. Capps leads the atmospheric modeling at Drexel Group, which conducts outdoor air quality modeling to estimate influences of reduction sources, evaluate health, ecosystem, and climate impacts of pollutants, and assimilate satellite-based observations to improve models. Thank you so much for being here. We look forward to your presentation.
Thank you, Akilah, and it's an honor to present alongside you, Professors Diez Roux and Scheller. So I will share my screen now. The question I would like to pose and hopefully answer today in this talk is whether satellites show us how changes in transportation habits, for instance, those that Dr. Scheller just presented during COVID-19 in US cities, have impacted air quality. Can we see that from space? So I have to give tremendous credit to two co-op students who have been working with me to answer this question. Scott Natter worked last spring summer cycle, and currently Nick Livolsi is creating these figures. And so I want to give them credit for the work they've done. The populous urban areas that we evaluated were the top 10 most populous core-based statistical areas. So when the US Census is conducted, they evaluate commuting patterns as limits to these core-based statistical areas. And so we've taken the top 10 most populous geographic areas where people are commuting into cities and are looking at these geographic extents to see how can we observe changes in air pollution within these areas. And so we want to look at pollutants that we can clearly observe from space that would be short-lived enough that we would see local changes in air pollution from local activity changes. In this presentation, I'll focus solely on New York and Houston so that the slides don't get too crowded, but we have looked at the 10 cities that are listed here. So you might be wondering, in a climate talk, what air pollutant would we focus on? It would be typical to talk about a greenhouse gas, such as carbon dioxide or methane. But these pollutants are challenging to detect from space in ways that we could observe locally over a city as having changed. I'd like to speak instead about a co-pollutant of CO2, which is nitrogen dioxide. There's a special camera called Trope-OMI that flies on a satellite that circles the Earth every day. With it, we get daily pictures of the concentration of nitrogen dioxide between that camera, which is in an orbit around space, and the ground. So we're taking a picture of the concentration of nitrogen dioxide between that Earth orbiting satellite and space. With this understanding of how sunlight is hitting the ground and then reflected to that camera, scientists can interpret the concentration of this pollutant in that column. As you can see in this example picture over the city of Philadelphia, which is an example of the extent that we're considering in one of the core-based statistical areas, the pixel size is about 3.5 kilometers by 5 kilometers. You could think of this as a pixel when you zoom into a picture you've taken with a camera as one dot in that image. In the same way, one column of information about nitrogen dioxide between the ground and that instrument is represented by that pixel of 3.5 kilometers by 5 kilometers. This is one of the highest resolution pictures that we have from space of any pollutant. And so it is very convenient for analyzing changes that have occurred fairly rapidly over time and in smaller areas like these core-based statistical areas. Let me make the connection for you between nitrogen dioxide and some of the climate-related pollutants that also are co-emitted. Nitrogen dioxide is made when people burn fossil fuels like gas in a car, oil or coal in an industrial or electrical application. So when people are making energy, they might burn this for production of electricity, or as we've been talking about throughout this session, when people are driving cars, they'll produce nitrogen dioxide. The coincident emission is of carbon dioxide or carbon monoxide. So it depends on how much oxygen is available in that combustion, but typically we have very efficient engines in cars, and so the majority of the co-emitted carbon species will be in the form of carbon dioxide. So wherever we see here a reduction in the nitrogen dioxide column attributable to transportation, we can understand that to be a reduction in the carbon dioxide emissions as well, which is the relevance that this has for climate. So hopefully I've convinced you that it's meaningful for us to look at these nitrogen dioxide columns from space. So Scott and Nick have taken those many pixels, averaged them over the Houston and New York core-based statistical areas as shown here on a weekly basis. That's just to take into account if there were clouds that were blocking the view of a column or other things that were obstructing something for one day out of those 7. So in the top panel, you can see these concentrations of NO2 for the column from the beginning of each year to the end. So this is a time series across the x-axis. And then each of the colors is representative of a different year. So the brown color is representing 2019, with the mean concentrations represented in the solid line. We've got the standard deviation there because we want to convey that there is some uncertainty. And so when we look at the time series for Houston, we can see that 2019 and 2021 have a higher mean in the March to April period than the 2020 purple line that is much lower. In New York, that dip is a little bit less evident. And so one of the things we wanted to probe is this connected at all to the behaviors that people have that are different in Houston compared to New York? This is a little bit related to what Professor Scheller was referring to in the sprawl that occurs and the way that that can increase the use of cars as the primary mode of transit. We do want to note that there are standard deviations and changes between these years that are not only attributable to behavioral change, but also to meteorological differences year to year. So given some of that uncertainty and the overlapping of these standard deviations, we wanted to take into account also ground-based measurements. That reduces some of the difficulty of looking at things from space. And in Houston and New York City, as well as many other cities across the US, the Environmental Protection Agency has installed monitors that observe something like NO2. It's a little bit more comprehensive in the species composed of nitrogen and oxygen that it measures, but it's a pretty good marker for the nitrogen oxide and nitrogen dioxide species that are present from this kind of pollution from cars. In fact, cars are such a large source of NO2 that in most of these places, the majority of the monitors there locally are near road monitors that will give us a good indication. And so again, if we look at this March, late March, early April period, which I'm highlighting with my cursor, you can see that we have more significant changes observable in Houston, even a change so significant that the standard deviation of 2020 does not overlap with that of 2019 and is significantly lower statistically. That is not quite the case in New York, though we do see some weeks with lower values. These are the daily maximum NO2 concentrations observed at those monitors. And it suggests that there's measurable change, both from the satellite, which here is shown in blue, with the percent difference from 2020 to 2019, and the ground monitors in red. So whenever you have a value below that 0 line, that means that there's a lower concentration of NO2 in 2020 than there was in 2019. So we're seeing that in Houston, that's pretty prominent for the late March, early April period, and fairly consistent between the ground monitors and the satellite-based observations. In New York, there is some notable change in late March, but that's a little less clear as we look at the rest of the year, that that's especially different than other time periods. Having observed these differences in pollutant concentrations, we wanted to see how would our understanding currently of emissions of this pollutant contribute to our assessment of why the concentrations are lower. Not only did transportation change, but also other things, industrial practices changed too. So here I'm showing a description of how in each of the core-based statistical areas that we studied. So those are represented from the West Coast on the left with LA to the East Coast on the right with New York, and the contributions from different sectors. So blue is representing transportation, which is called mobile sources. Orange is representing fuel combustion, primarily for production of electricity. And then green, which has a little bit of a contribution in Houston, is from industrial processing, like much of the processing of petroleum products that is conducted in Houston. One of the things that's important to note as we focus in on just Houston and New York is that New York has the highest total NOx emissions. So we would expect those concentrations to be higher overall. But for a per capita basis, it actually has the lowest mobile emissions or per capita transportation emissions of any of the cities we analyzed. In Houston, on the other hand, though the total emissions of NOx are lower, the contribution per capita from transportation is much higher than New York. And so we want to use that to understand, okay, is there a way that we can see that behavioral change in transportation, in the transportation sector, would be more evident in Houston in the concentration of that pollutant than it would be in New York? So having considered the relationship of these sectors, we wanted to look at changes in measure of behavior. So Dr. Scheller showed actual vehicle miles traveled changes, and this is a little bit different representation of the same thing, changes in measures of behavior. In green, you can see from Apple Maps the changes in the percent of driving requests, and in orange, the change in Google's assessment of whether people are staying at home or not. For both of these, again, when the value is below the 0% line, it means that there was a reduction in driving or an increase in someone staying at home for 24 hours at a time. We can see that the behavior change for staying at home was approximately similar for New York and Houston in terms of the percent change. So the percent of people staying at home in Houston was similar to that in New York. And there's a larger recovery of the change in driving requests in New York compared to that in Houston. So if we put all of these pieces together, we have the same color scheme from the previous plots and are just overlaying these time series. So we have, again, in blue, those satellite-based observational changes, and in red, those from ground-based monitors, whereas the green and orange behavioral changes are the same as in the previous slide. What we note is that there is a less evident change in the NO2 metrics, the pollutant metrics, in New York compared to Houston in the late March to early April time period, even though the behavioral changes on a relative basis were approximately the same at that time. And so what we want to posit is that we have a more evident change in pollutant concentrations where there is a higher contribution per person to these pollutant emissions from the transportation sector in Houston as compared to New York, and that is even observable from space. So perhaps when the satellites are able to see CO2 equally well, they would observe the same change. And I think it is a good indication that we have evident changes in pollutant concentrations from these behavioral changes that the previous speakers have been discussing, which is really exciting to think about when we consider the potential of those reductions. As Dr. Scheller pointed out, the recovery is perhaps concerning given that there aren't substantial changes persisting in the NO2 metrics later on in 2020. So I'd like to again thank Nick and Scott, the co-ops who've produced these pieces of data analysis and graphs. I'd also like to acknowledge NSF for funding that supports especially my contributions to this, and Professor Wu at the University of Tennessee, who helped with using this Python package he developed, GEE map. Finally, Tramel Kongmung Liu is a PhD student in the group who had helpful suggestions that contributed to this work. Looking forward to the Q&A now, and I'll turn it back over to you, Akilah.
I want to thank again Dr. Diez Roux, Dr. Scheller, and Dr. Capps for presenting with us today. I personally really enjoyed the talks, and I think I speak for everyone in attendance here today. I want to get started with some questions here. So a question for the group. Of the many climate solutions that would impact climate change, transportation, and public health, what do you see as the most promising and impactful solution?
I can jump in there and just say, I mean, I think Dr. Diez Roux offered some really interesting options, and both infrastructural things, like we clearly need investment in public transit, and our funding mechanisms currently for public transit depend a lot on revenue from riders, right? Charging riders. And another way to fund public transit is to have free public transit and then fund it through public means that is distributed more equitably across the population. And in many ways, we subsidize driving, we subsidize highway building and fossil fuel infrastructure. So if we changed our subsidy system and we kind of shifted those subsidies to public transit and made it free for riders, that would have a huge impact on improving health, accessibility, use of public transit, and recovery of our transit systems.
Yeah, I mean, I agree that, we have a system, it's remarkable, but we have a system that is heavily favors and subsidizes and supports automobile transportation. And yet we don't recognize it. We have to flip it completely so that the default option is public transportation, walking, cycling. And that has a lot of implications, as Mimi was saying. It has implications for investment, for public spending, for what kinds of investments we made, for I think Chuck had a comment in the chat. Yeah, it has implications for land use decisions, planning, basically planning, which has to do with land use, and that drives mobility, et cetera. So, I think somehow breaking our dependence, if I had to choose one thing, I mean, there are many, many things, but if I had to choose one, I would absolutely say it's cutting our dependence on automobile transportation and incentivizing a different kind of mobility and supporting it too. Yeah.
I think that those are really helpful visions, and given that so many of the emissions are arising from urban areas, it does seem like that would be a very practical approach in cities in America in particular. I'm also aware, though, that we reside in a country where there may not be public transit solutions that are possible in more urban areas. And so one of the things that is pretty phenomenal about the change of technology over time with nitrogen dioxide emissions from power plants is that technology was developed to scrub the NO2 out of those flue gas emissions. And so it may be an alternative for places where public transportation isn't a feasible way forward to electrify the fleet and then to capture pollutants or use green energy production methods to power those vehicles as opposed to using fossil fuel as the means of powering automobiles, or especially the large heavy diesel fleet that transports many goods across the nation. And so I think that was one part of the transportation infrastructure that did not change as significantly during the pandemic. Goods were still being transported for much of it. And that's not something we have a great solution for besides perhaps electrification.
Dr. Capps, we have a follow-up question for you. Is the resolution of measurement fine enough to differentiate between urban core versus urban, suburban, ex-urban areas in the same region?
Thank you, Professor Haas. Yes, the footprint is 3.5 kilometers by 5 kilometers, which should be quite sufficient for seeing the change from an urban core to especially the ex-urban area. Some of the challenge is just statistical power. So it's not something that we've presently attempted, but it is an interesting idea. One of the other conflating factors is that given that this is a concentration-based measurement, the lifetime of NO2 is long enough that the wind can blow the NO2 from an urban emission into the ex-urban area if it is downwind. And so to do that analysis, we would have to take into account the direction of the wind, which is quite feasible, but not something we've yet done.
So if there's not another question right away, I could go back to the question Professor Haas raised about zoning and land use, which also I didn't reply to. And yes, I think that is extremely important, and that there's a complex relationship between all forms of mobility and transportation and land use. And to add to our conversation, the other aspect, of course, of the pandemic has been the rise of digital work and digital mobility, communicative mobility, you could think of it as. And what's that ongoing relationship going to be between where work is located, where homes are located, and then do we connect physically or do we connect digitally? And all of that is in play right now, and will have important determinants on how cities come out of the pandemic. And it will be different in different cities. It will depend on which industries are predominant, which kind of remote work is enabled. But we're also seeing this huge sprawl effect, I think, we're seeing in the housing market of people buying houses, those who can afford them, outside of cities, and building boom. And we know there's like a huge shortage of materials and huge amounts of freight delivery, right? Which is at its limit right now, right? They can't deliver freight quick enough to get building materials out, to get appliances, all of those things. Which also links to seaborne transportation as well as land transportation. But a whole complex set of systems and infrastructures are involved here. And I think part of my argument was that not only do we need like planners to think about that, or policymakers, but we need people, communities to have some self-determination to be able to talk about what their needs are and what the impacts of some of these things are. So when we locate, for example, the Amazon warehouse on what was going to be the location for SEPTA's new electric trolley fleet to be serviced, that there's a trade-off there, and we need to really have policymakers think about what are those trade-offs, who's benefiting and who's not.
Thank you for that. We have a follow-up question for you, Dr. Scheller. One thing I'm grappling with, even within my MJ groups, is how to address the issues with increased speeding and general shenanigans happening on empty streets without using police. It'll be a long time before infrastructure is able to address this.
Yeah, thank you. And for MJ groups, for everybody, those are mobility justice groups. And Sequoia Erasmus, who put that question, is part of those groups, and they're forming and empowerment across the country. And I think this also links to, there was an earlier comment from Rogelio Mignana about the lack of safety right now on public transit. So we both have a sort of epidemic of speeding, sorry, public health people for using that term, of vehicular violence. And then we seem to have this increased violence happening with the lack of people around on public transit. So there's this general, I think, anxiety around safety right now, and the threat of being out on the roads or the rails. So yeah, so the policing question, it's interesting here in Philadelphia, we, after a huge campaign waged by the Bicycle Coalition of Greater Philadelphia in association with the Vision Zero kind of alliance, got speed cameras put on to a state managed road called Roosevelt Boulevard. And it took a long time to have the state allow Philadelphia to do that. It's a road that goes through the city. It's extremely dangerous and is a high crash location, but the speed cameras have vastly decreased the rate of speeding, and incidents of speeding have gone down, which makes the road safer. Now the question is that how long will that effect last, right? Sometimes when speed cameras go in, there's like a kind of effect initially, and then it sort of wears off. So it'll be interesting to watch that. But one of the arguments is that the speed camera is a more equitable solution than policing. Still, I think, debatable, but it's interesting.
Earlier on in the presentation, another question was submitted, so I'm going to go ahead and share that now. It appears the decline of public transportation in the pandemic has created a positive feedback loop where the less people use it, the less funding it receives, and the quality of travel decreases, leading to ever more people moving away from public transportation. And to follow up with that, one of the attendees wrote, I use public transportation regularly and conditions have deteriorated gravely. The subway in particular has become much more insecure and less clean. In Center City, many streets are traffic free now. How can we, and by we mean the local government, make sure less traffic and better public transportation go hand in hand? What models in other cities have been proven successful? And this is a question for the group.
So, I have a few thoughts in relation to these questions. The first is, I think we have to recognize that public transportation is not a money-making enterprise, and I think one of the participants commented on the fact that public transportation systems have to be subsidized. So we have to get out of our head the idea that we're somehow going to finance public transportation with the fares that we charge users. Public transportation is a public service, and as you see in many, there's been worldwide a movement towards reducing fares or even making public transportation free. And that does mean, of course, paying for it out of public funds, out of taxes, out of other sources, right? Actually, we do subsidize cars a lot because we pay for highways, we pay for a number of things that benefit automobile transportation, but so we're doing that, but we're putting the money in the wrong bucket from my perspective. In terms of what cities, what are the opportunities here after the pandemic in relation to, we have the streets are empty, people are going to start to come back to work. What can we do so that it's different. Well, some cities are doing some things. Paris, for example, as you may have seen, has closed down traffic, will close down drive-through traffic through the center of the city. The mayor there, Hidalgo, is quite progressive in terms of environmental issues. And other cities are trying similar things. So the question is, when we reopen, can we reopen in a way that doesn't open up the streets? Yeah, all the cars come back without restrictions. Can we reopen in a way that limits automobile transportation in the city, and that in parallel supports the improvement of public transportation? You have to do both, of course. It's unfortunate, for example, Philadelphia, for example, has decided to reopen MLK to traffic, for example, when it had been closed. That in my mind is unfortunate, because we had seen how valuable that was for physical activity, and yet we're going to open it back up again. So I think we have to, now is the time to take some new bold actions, because we have the opportunity.
And I'll chime in there just to say, I mean, I think we know a lot of good policies in certain cities in terms of making walkable, bikeable city centers. One of the issues, though, is in the cities that do that, for example, in certain European cities, they have heavy protection of affordable housing. They have public housing, social housing. And so, for example, when Amsterdam, for example, or Copenhagen kind of transitioned to become more bikeable cities, they had a public housing system that enabled people not to be priced out of the city center. So I worry, my concern in Paris is that, yeah, you can make the center of Paris fabulous, but how many people can afford to live in the center of Paris? And so will that create a kind of green gentrification effect? And the surrounding suburban, what are known as the banlieue, where more immigrant populations and people of color live, will maybe not benefit in the same way unless thought is put into those policies. On the other hand, something we often don't think about is there are examples happening now in especially African cities where there's been a major kind of increase of informal transportation. So where there are some public transportation systems, but really the mass of people get around on informal systems. And the question is, can those be electrified? So there's been massive increases in the number of moto taxis, which are like motorcycles, but they're currently fossil fuel, right? Bikes, but they're starting to transition to electric bikes, e-moto bikes, taxis. So what are sometimes called boda boda. So there's a platform now called Safe Boda that is also using mobile technology, right, to coordinate. So you can imagine big cities with big problems around access and land use patterns could sort of leapfrog towards electric vehicles that combine informal transportation with some public transit systems. And that's a really promising way forward, I think, for some of our bigger cities. And maybe we in the developed world in the US could learn from what could be happening in African cities and Asian cities.
Thank you. I have a question for Dr. Scheller from one of the attendees. Can you elaborate on the right to stay in place concept?
Oh, yeah, thank you, Sarah. I mean, that touches upon what I was just talking about, which is affordable housing. And, there's big campaigns on the progressive left and the Green New Deal kind of policy platforms right now in the United States to build affordable housing. And whenever you change a transportation system, if you make a place more accessible and more linked to desirable places to work and to live, it drives up housing prices. So for example, if we were on the Northeast Corridor to get high-speed rail, which many people want to connect Washington, Philadelphia, New York, Boston, look at Philadelphia's housing market and compare Boston and New York. We're much more affordable compared to Boston and New York. But if we're linked with a 50-minute high-speed rail line, the market effect is going to drive up our housing prices. So unless you think through the protection of affordable housing, and again, that idea of gentrification, but it's prices that will go up, taxes will go up, people won't be able to stay where they are. That's partly what I mean by the right to stay in place.
Thank you. So we have another question from the group. One attendee asks, along with the grain and economic recovery, is there a concerted effort to appeal to the city of Philadelphia to have more restaurant tables on sidewalks and streets post-pandemic? It could slow down traffic, help the restaurant industry, and create more placemaking. But at the same time, another attendee is pointing out the intrinsic conflict between street closures for streeteries and transit. In his neighborhood, some streets have been closed down for restaurants, which have led to significant route diversion for buses, which then makes transit less convenient. Do you all see the way forward given these conflicts?
Well, absolutely, I agree that the streeteries are problematic because it's a phenomenon that appeals to people with disposable income and time to sit out having brunch on the street. And for the workers, the people in the service industry who are at those restaurants who maybe can't afford to live in biking and walking distance, yeah, their buses are going to be diverted, or they're going to have longer journeys to work. In many parts of the country, actually, there's a huge shortage right now of workers in the service industry because they can't afford to live close enough to the jobs and get to the jobs right now because of the decline in service of public transit. So it's a real catch-22. And in the geography literature, we often refer to that as a kind of splintered urbanism, a term developed by Steve Graham and Simon Marvin. And splintered urbanism is where you see like infrastructures that serve the wealthy being invested in and connected and faster and cleaner and better, and then infrastructures that serve the poor being kind of left behind, and their condition is made worse and less effective.
I think it's complex, right? Because at the same time, we also know that the system that we have right now, in terms of transportation, the health, as I was saying in my talk, the ones who are most exposed to air pollution related to car emissions are the poor, not the rich. And so the system is not that we have in place is not benefiting poor and minority communities. And so I think there are ways in which we can reduce our reliance on automobile transportation, recuperate our streets for pedestrians and cyclists without disadvantaging the poor. In fact, with benefiting the poor and reducing inequities. And that, of course, requires a number of different strategies together. It requires, strategies to address housing, affordable housing, where people can live, making public transportation affordable and free and quality, and convenient. But I think it would be a mistake to say that we can't implement strategies that make it more difficult for people to drive, because that's really what we have to do from my perspective. Because that would increase inequities. I think we can do both. We can address inequities by reducing our reliance on automobile transportation at the same time.
I think building on that, Professor Diez Roux, there was an interesting component of the cycle that I think you showed, Professor Scheller, where ample parking was a part of the cycle that increases dependence on automobile transportation. And so I wonder if there is an implicit way in the streeteries to accomplish the goal of making automobile-based transport into and out of cities for luxury spending less automobile dependent. And so if the streeteries were limited to the places where street parking had previously been allowed, kept off of sidewalks to not inhibit accessible transport by people who are needing ADA compliant sidewalks, then one might argue that the goal of reducing access to parking is accomplished while maintaining more safe modes of eating, that is to not have folks exposed to the indoor environment where accumulation of disease can occur more rapidly than outdoors, where the wind will blow airborne disease away. So I think that that's an interesting proposition, though I agree that it would need to have some limits in not running into spaces that would be used by buses.
Thank you. All right, with note of the time, I want to propose one last final question for the group. We are here representing many different disciplines: public health, social sciences, engineering, and natural sciences. Addressing climate change will take all hands on deck, and we need to be collaborating towards solutions. Are you seeing interdisciplinary teams like this coming together to address climate change?
Absolutely. I mean, I think part of Drexel's climate year and other initiatives around climate have been about building interdisciplinary collaborations across the university and across the city. And so we're seeing, and maybe Corinne might want to talk more to this, we're seeing, plans to create working groups to work on issues around climate in our region, as well as across the Northeast and the country, that involve interdisciplinary teams, as well as academic and non-academic, I should say, right, including partners in government, in community-based organizations, et cetera.
Yes, I think there's an interesting, I think Professor Scheller brought up some of the intersections of advocacy for racial justice alongside mobility justice. And it seems to me that some work even on the environmental justice front, which might encompass climate-related policy changes, is an opportunity to capitalize on those relationships that not only span disciplines within academia, but also into communities, and that's the type of collaboration necessary to move things forward. And I've been really excited about the vision of especially the Academy of Natural Sciences to begin to become a space where those types of conversations can be held productively. So I think that's one thing that's happening at Drexel that does seem quite promising on that front.
Okay, do any of the three of you speakers have any final thoughts that you'd like to share with the group? And again, I personally want to thank you so much for being a part of this today.
I've just had one final thought, which we often don't talk about in these contexts, is the whole question of our consumer economy and the question of degrowth, right, or post-growth economies, which also relate to indigenous land, which Corinne began with, and the land back movement and the respect for the land and not engaging in extractive industries. And there's many further conversations I hope will continue in another session someday.
Yeah, I hope this is
putting this together and for hosting. Sorry.
Go ahead, Shan. No, I was just going to say that I hope this is the beginning of more conversations on this topic. It was great to share this panel with Mimi and Shannon, and I think, this illustrates how there is this interdisciplinary community at Drexel that can come together, right, to discuss these things and think about what we can do. So, thank you.
Great, I'll just, go ahead, Akilah.
Yeah, I think that is about all that we have time for today. I want to thank you, the three of our speakers, but also everyone else in attendance for being a part of this conversation and for your input today. I hope everyone has a lovely weekend and gets to enjoy the sun and the warmth outside.
Thank you all. Thank you, Akilah. Thank you, Corinne.
Thank you all so much. Have a lovely rest of the day.
Bye, everyone.
Bye-bye.